Khair, inshallah. I think we can go ahead and get started, and those who joined late can catch up, inshallah. We'll also share the recording. Bismillahir-Rahmanir-Rahim. Alhamdulillahi Rabbil Alameen. Wa sallallahu wa sallam wa barak ala Nabiina Muhammad wa ala alihi wa sahbihi ajma'in. Thank you all for joining. As you know, this is the fourth such webinar that AMA sets up in this time since the beginning of the self-isolation or the social distancing has started and the masajid have been closed in order to bring the community together and address topics that are very needed in our community and also relevant to the time. So the first two were Q&A sessions with Sheikh Anas and Sheikh Ahmed Shakairat. The third one was with Dr. Anisa and Sister Amal. They talked about mental health. Today, of course, we have our distinguished members of our community, doctors, to talk about the current situation in the U.S. and how we can protect ourselves and answer your questions, inshallah. We also have one coming up next Saturday. We haven't sent out the flyer yet. It will be about Ramadan and our health with Dr. Shabib Al-Hadri. So, inshallah, you'll be seeing that flyer throughout or in the coming days. Please plan on attending, inshallah. So, without any delay, I'll pass it over to Dr. Shakur, inshallah. You all know Dr. Shakur. He's a pillar of our community, mashallah, known to everyone. I approached him asking him if he can participate in this Q&A session. And mashallah, from there he set it up. He invited the other doctors and set up the whole thing himself. So I'll let him take it from here and he'll moderate, inshallah. After everyone gives a brief introduction, then we will take everyone's questions and have the doctors answer them, inshallah. Dr. Shakur, you want to take it from here?
Yeah, thank you, Ahmed. I really appreciate. Rightly said, the masajids are closed, and we have a lot of question answers which are still pending, and we don't know the real answers. And inshallah, as we tackle this new situation, hopefully our ulamas are working hard, I know, to keep a contact in some way or shape. I know Dr. Muharram, Imam Muharram and ICC, they are trying their best to connect. So that's beautiful. Today we are here to discuss COVID-19 pandemic. For that, I was very lucky, and we are all very lucky to have our own doctors in the community who are very educated and are actually in the front lines, and they are doing their work diligently at various capacities. And not only the doctors, the nursing and the paramedic, and even the shopkeepers, and everybody's pulling their load, very well, alhamdulillah. But really in the forefronts are the infectious disease and pulmonary medicine and hospitalists. When you or someone or loved one are admitted in the hospital, these are the people who actually are the brains behind their treatment package as to whatever happens. Even the hospitals are looking towards these two specialists, especially the infectious disease, the pulmonary medicine and hospitals, as to how to put this team together to get the best care possible in US. And we are very lucky to be here in the United States, where the system is really amazing. In spite of what you're hearing, in reality, there is no better system or healthcare. That's just my own opinion. But let me introduce you. Let's get going, and I have some question answers going. I know we'll be joining shortly with other brothers and sisters, and so we have on the panel Dr. Irfan Khalid. I don't see him in the video, but I'm sure he's going to turn on. He was driving when the last I heard. And he's a pulmonary critical care specialist. And he has done his residency in New York Medical College, and then in University of South Alabama, he did his pulmonary critical care. And currently he is working as a critical care specialist who in Deer Valley area in the West Valley. So critical care specialist, we will hear from him what he really does, but I can just briefly tell you that he's the person who does intubations and all those complex. The ICU care is under his domain, and so Alhamdulillah, he's here. Thank you, Irfan, for joining. And next on the panel is Dr. Zubair Qureshi. He's graduate of Nishtar Medical College in Pakistan, one of the very reputable medical college and very old institution with a lot of great history. He did his infectious disease fellowship in Pittsburgh, and he's currently with Synergy Infectious Disease Physicians here in Mesa and East Valley. These both specialists are very hard to find these days. They have, I'm sure, they have many other responsibilities today. And then the third one, which is Musa Shakur. I have requested just today. He's in Dallas. He's a hospice working as a first-year resident, and he's asked me all these questions about COVID, and some of them I know, and some of them I don't. And so this is a great opportunity for all of us to learn together about this disease. Irfan, you are on the critical care. How would you like to start out with a few words initially? And
Assalamu alaikum. Can everyone hear me and see me?
yes, we can.
Well, thanks for the opportunity. At this point, I would like to stress the community to follow the rules. I mean, most of what you're hearing from CDC and from different healthcare agencies are very good instructions, and there is no doubt about that we have to follow those, and that is the best way to deal with this pandemic. Social isolation, hand washing, how to cough, how to protect others from getting infected are the main issues. Now, virus affects, the symptoms are upper respiratory most commonly. The simplest would be the cough and fevers. It can affect the GI system. So there are people who have come to hospital with diarrhea. People have also come in with pneumonias. And we actually have one patient who came in with heart issues as the primary presentation. So if you suspect that somebody has it or somebody is infected, the first thing is to isolate yourself and then find the nearest place where you can get tested. Or if you're not very sick, just stay home, do what we call symptomatic treatment with Tylenol for fever, keeping you hydrated, and see, I mean, if it just passes by. Majority of patients who are not severely ill will get mild disease, and their immune system will take care of it. Most people who would get affected more is the elderly population or people with diabetes, heart disease, lung disease, people who are on medication to suppress their immunity. So keep those things in mind and wear a mask. You don't need an N95 mask most of the time, just a regular mask will do. A face shield or glasses or goggles will help. Now, if you are in mild disease, you can shed the virus, can get other people infected for 10 days. In severe disease, it can be longer. If I mean, you start getting respiratory symptoms, the best thing is just to go to the hospital. Dr. Shakur, any other information that you wanted
So,
to
no,
get?
let me start with this. So, Zubair, so let's go with what are the presentations? Typically, how does it present? You are, many times we have common cold all the time. And so how do you separate, or what are some of the warning signs that you think that this is not a common cold, this is actually something I need to pay a little more attention?
Right. Thank you, Dr. Shakur. Very important question. I think it's very, very difficult to differentiate this virus from other upper respiratory viruses just on the basis of symptoms. The most common symptoms that Chinese people have reported, and now we are getting more data from New York, is the fever, then cough, which is mostly dry cough, and then slowly it progress into difficulty breathing. People are coming in and telling you, oh, it's becoming hard and hard to breathe. And then they have this malaise, this tiredness. So if I compare with other respiratory viruses, when you get that common cold, first, first foremost, you get that runny nose. We have rarely seen runny nose with this particular virus. So as of now, I would say if you are having runny nose, there is a good possibility it's some other virus than this one. This one mostly goes towards cough, fevers, then respiratory difficulty, and your oxygen level in your body starts declining. And that's the point where you have to go and seek medical attention when you start having that shortness of breath. So, I mean, on the symptoms-based basis, I will still say it's very, very, very difficult to distinguish this virus from other viruses.
So we'll spend a little more time on this, and I'll come to you, Irfan, a little later on this. So let me pick Zubair's brain a little bit. So, like, in a house, we have children, we have our parents, and other folks in the house, and most men or females or young men or women, they go out and work, for example, in shops and in other places, and they come in home, and they are, our routine has been maybe wash hands and then go and have your dinner and sit down and hug your mother and hug your nanny or grandparents, and then so should we change this routine a little bit?
Uh, I mean, so there are no standard recommendations. What I personally do when I come back home, I just say salam to my kids and my wife, and I go directly to my wardrobe. I change my clothes. I come out, I take shower, and then put new clothes on, and then come down and see my family.
All right. So, Irfan, is that your routine?
Yes, I mean, if you're in an environment where you think you can get infected, the best thing is to not contact with somebody, especially actually people who are elderly, who can have severe disease. To protect them, at least hand washing before. And I mean, if you come from some place where, like when I come from hospital, it's a must that you change your clothes, put them in the washer and dryer and before. At our hospital, actually, they've started providing scrubs. So when you go in, you change, you wear scrubs in ICU, and then you leave them before you actually leave the hospital. So changing clothes is important, hand washing, and like Zubair said, I mean, those are good advices.
So, like a person who works in an office, like who works in a I mean, I know people are these days, they are almost PhD by WhatsApp information on COVID. They are actually more educated in many ways than many of the doctors because they are always on the WhatsApp and learning more and more, good and bad. Anyway, so in a common, what can we suggest to our community? What should they be doing in this situation? Should they, like you said, you come in home and wash hands, and so at the least, and then they.
Yeah. So when you're
that
going
what-
outside, I mean, it's the same thing. If you can wear gloves, if you're going to touch a lot of things, social distance is important. So when you're outside, practice social distance. And when you're in a grocery stores and all that, and you come back, if you the main thing over there is so the precautions you can do is it can spread from touch, coughing, so droplet spread, and so I mean a basic mask would actually be very helpful. They don't need an N95 mask and all that. A basic mask just to protect yourself would actually be sufficient. And wear glasses. So that is what they can do to protect themselves. When you come home, take those things off, wash your hands, wash your face with soap and water, and then they can do their normal work. And if they have this suspicion that they have come in contact with somebody who had an upper respiratory tract infection, like I was saying earlier, it can take up to 10 days. I mean, there's 2 weeks of latency. And if you do have people at home who you think will not do well if they get an infection, they have to practice caution.
All right. So I will ask you that. So we were talking about symptoms. So I think from symptoms, so once we determine that this person has uh, more than just like you had mentioned earlier, the symptoms of COVID are basically a fever, cough, a chest pain, shortness of breath, difficulty breathing, or headache. And but there are overlapping with a lot of runny nose or your typical allergy, then one should not get too worried. They can wait if they don't have some of those fevers and a cough and chest pain or shortness of breath. So they can wait. Is that a fair statement to say?
Yes, they can. I mean, so milder symptoms, most people will get better. So, I mean,
Okay.
unless you're starting to develop shortness of breath, breathing issues, you start developing breathing issues, you go to hospital immediately. Because, I mean, one person, so my one patient that, so he came from Bosnia. And so he was high risk. So he was good for about 4 or 5 days before he came to the hospital. And after he came to the hospital, I mean, he got sick very quickly, and he did not have too many um, risk factors for him to actually become that sick. So I think his exposure was pretty severe, pretty significant. And breathing issues should be the key. I mean, if you start developing shortness of breath, go to the hospital. Otherwise, most people will get better with milder symptoms.
So would you tell us something about the age bracket, which we should be more careful, the high risk group?
So most of what the way we are going by is 65 and above, age-wise, and people who have other diseases that can make them sick faster. So kidney disease. I mean, people who are on dialysis, people who have cancers on therapies, people with lung diseases, asthmatics, COPDers, patients with long-term hypertension. Um, so those are the ones which should be the ones more careful.
All right. So Zubair, now let me ask you this question. So now somebody feels that this person may have COVID and the family is worried. What should they do?
I think first of all, that person should self-quarantine himself or herself. This is a very contagious infection. I can tell you few numbers in comparison to regular flu. So when a person gets regular flu, he can transmit that infection to 1.2 to 1.4 people on average. So those 1.4 people can transmit it further on. So by the 10 layers down the line, one person can actually transmit flu to almost 16 to 20 patients. When it comes to this coronavirus infection, which epidemic we are seeing now, one person can easily transmit that infection up to 3 people. Then those 3 people will transmit that infection further on. And 10 layers down the line, you can actually transmit that one infection to more than 20,000 people. So the contagiousness of this infection is worrisome. That's why whole emphasis is not on the treatment, it's on the prevention, prevention, prevention. And the 3 major factors for the prevention is hand washing. I will take little bit time. When you wash your hands with soap and water, make sure that you are washing your hands for 20 seconds. There have been data that if you wash your hands with soap and water for 17 seconds, still a lot of virus will stay on your hand. So the cutoff is 20 seconds. You have to do that. And if you are using alcohol-based sanitizers for your hands, make sure alcohol sanitizer has more than 60% alcohol in it. That's the only sanitizer that will work for this kind of a virus. And there are so many non-alcohol based sanitizers, they do not work for this particular virus.
Good point. So, what should suppose I first of all you can't find a sanitizer if you're lucky.
Yep.
So the best course of action, soap is widely available.
Definitely. And soap and water is actually way better than alcohol sanitizer when it comes to washing your hands,
I see. I see.
as long as they follow 20-second rule.
They can recite Surah Fatiha slowly, and you'll be good.
Exactly.
And so once you have, like you said, so if somebody feels that this person has, or their mom or their dad or themselves have COVID, so first of all, you said quarantine yourself, then put a mask, and
Then
then
put the mask on. If you want to get it checked and you want to see your PCP, please put the mask on before you leave the house. You do not want to spread this infection to others.
right.
So first thing is quarantine yourself at home. If you have older people at home above the age of 65, please do not see them for next at least 14 days
Okay.
till you recover out of it completely.
All right. And then make an appointment with the doctor for
Yes,
testing.
make an appointment with the doctor, and when you go and see them, please call them and let them know that you are having these symptoms, so that they should be ready to see you. Because there might be 10 people sitting in their office, so they will have to see you right away. You should have your mask on. Don't touch anything in the office, and doctors will order the testing and whatever they feel comfortable with.
Right.
But at least patients should take responsibility not to spread this infection to others.
And they should not fill up their car with friends when they're going to see a doctor. Right.
For sure, because that's the whole rule of social distancing. Social distancing is you should stay at least 6 feet away from other people. And the reason for that is when you cough or when you sneeze, this infection spread by droplets. So droplets can go till 6 feet. So any person, if you cough up or you sneeze, people within 6 feet can easily get infected.
All right. Very good. So and so what we learned is that you quarantine yourself and make a phone call to your doctor, make an appointment, and tell him that you're coming for COVID, and then listen to their advice. Don't use public transport, and don't fill up your car with unnecessary participant in the car. So
Exactly.
we go alone or with somebody who can help you. And all right, so now we are in the doctor's office. So he tells you that you have either a problem or you get a result in how many days?
So there are a lot of tests available nowadays. The most common test that they are using now, it's called PCR testing. So if in PCR testing, they take nasopharyngeal swab where they put this cotton tip in your nose and take a sample from back of your nose. And when they send it to the lab, if lab runs the test right away, test should not take more than 3 hours. The problem is labs are batching all these tests together because it's a labor intensive process. So the turnaround time nowadays is around 24 hours to 48 hours. So it's still pretty good in comparison to a couple of weeks ago. And FDA has approved all these new tests like 45-minute test, 15-minute test. These are not the real PCR tests. These tests are actually immunoassay testing. You know, the way we used to do rapid flu testing in the hospitals? It's the same kind of test for this coronavirus. If these rapid tests come back positive, then they are useful tests. But the sensitivity of these tests is very low, around 50%. So if the test comes back negative, you still have to confirm that negative test by doing a PCR testing.
I see. I see. All right. So, so test-wise, so what accuracy of a suppose I get a negative COVID test, and how comfortable I can be that I have no COVID.
So if your test was a PCR test, the suspicion, the sensitivity is around 70 to 75%. But so that's what I'm saying. Like
Tell us in simple words, what does it mean?
simple words is like if this test can still miss 20 to 25% of positive patients.
Got it. Okay.
So if you have typical symptoms of COVID and your first test is negative, your physician can actually repeat a test in 3 days to confirm it.
Okay. All right.
Yeah, that brings up the sensitivity to around 95%.
All right. And so like we have learned that if you negative test, you're okay. But if you do have a positive test, what happens then? What should we?
If you have a positive test, then you have a couple of scenarios. Like your doctors will evaluate you, like how sick you are. As Dr. Khalid was saying, if you have a mild disease, doctor may just send you home, stay home, self-quarantine, keep yourself hydrated, control your fevers with Tylenol, and that's pretty much it. I mean, if doctors think that you start having shortness of breath or your oxygen level is dropping in your body, that's the time they will refer you to go to the hospital.
All right. So if somebody is quarantined, so and he's doing fine, he's good. After 15 days, he should be fine. But if you go to quarantine and you don't feel well, you have shortness of breath, you need to raise your hand and let your doctor know. Is that true?
Oh, for sure, yes. That patient has to go to the hospital, and because COVID patients are prone to developing pneumonia pretty fast.
Okay.
Their lung functions decline very fast. So yes, shortness of breath is the danger sign, is the red signal. Upon that point, you should contact your doctor. If you are not able to contact your doctor, please go to the ER and they will evaluate you and go from there.
Irfan, you want to say something about it, the shortness of breath? Because when you see them, they are in a quite dire states, you know. Then the train has left station
Yeah.
at that. So they should come early to the hospital.
Yeah.
All right. So Musa, are you there on the line?
Getting shortness of breath. If you
Hello.
Oh,
Okay, Musa, are you online? Musa.
yeah.
So Musa is in the trenches. He is the person who deals with the first patient who show up in the ER, and he's the person who takes a history, and then patients go up to the room, and then from there, whatever happens. So how are you able to take the history from the patient who suspect of COVID-19? Is it
Yeah, so I'm working in Dallas now in a large community hospital in Dallas, Texas. So we're being, I think, hit by COVID, probably similarly to Arizona, maybe a little bit worse, but it's not like it is in New York or New Orleans right now. But I think basic triaging in terms of are these symptoms consistent with COVID? These lab values, certain lab abnormalities that might be more likely to be COVID, lymphopenia or elevated liver enzymes, that sort of takes about a day to come back. There's one lab that takes several days. During that testing phase, they are under airborne or at least contact isolation. Going into their room, you're going to need to wear like a gown, wearing a face shield, a mask. You wear the N95 unless. But I think overall, the basic general information I would just.
Your voice is very
would be
static, Musa. Can you?
Actually, Musa, I think it might be better to turn off your video. That might
Go
be
ahead.
advantage for the audio.
So you can go ahead and start.
Can you do better?
Yeah.
Sure. Yeah. The main take-home points I would say for this, in terms of from my perspective, are sort of the idea of flattening the curve, which I think many people are aware of. That I think Dr. Craig mentioned like this reproductive COVID compared to the flu, the R naught value you might have heard. It's about 2.5 or 3 for COVID. So one person on average will spread it to about 2.5 to 3 people. And part of that is we don't have a vaccine. People are not immunized, and a novel virus. It's come straight from an animal. So no one has immunity to it at this point. So it is very infectious, right? So at this rate, given that there's not going to be any vaccine, derived from that R naught, about 50 to 60% of people will get. It's just over distance as possible, or as long a time period as possible. If 60% of people get that in the next 2 months, it's a huge problem compared to 60% of the population gets that over years. And there's multiple reasons for that. One, the hospital systems will get overloaded. And we might, in the next 12 or 15 months, develop a vaccine or develop some treatments that make this COVID in 20 compared to right now. Treatments are trials are going trials right now.
Musa, your voice is still kind of breaking. I'm not sure what is happening. Could you look at it? So I'll call you and you. Could you fix the sound, please? I think you can get to a better position. I don't know where you are. Okay. So your what you were saying was this. Actually, people are very good with Dr. Fucci's explanation, the curve business. I had never understood before, but now I understand how to flatten the curve. I thought you can just sit on it and it will flatten. It doesn't work that way. So, Ahmed, I'm gonna wanted to say that if anybody has any questions, please they can flag and we can take some questions as well.
So, yes, perhaps we can, if anyone is on the line would like to ask a question, please unmute your phone and go ahead and ask your question. I have a list here of my own questions.
So no, you go ahead. Do you have any question?
My first one is actually about the concept of flattening the curve and maybe the social aspect of the whole matter. So right now, most people that are able to work from home are instructed or are working from home. Schools are closed, and maybe some schools have their online programs instead of in-person classes. So, but you look at the number day to day, and it still seems that it's picking up steam. It has not, the slope or the rate of which the number is increasing has not shown to be slowing down. So is there any expectation on how long will it take before our lives start becoming or going back to normal? Is this a week, a month, a year? I know it's all a prediction at this point, but is there any kind of guideline when we think things will start to get better, inshallah?
So, Musa, I'll let you take the first tab, and then I'll ask Zubair about it. Are you online, Musa? Hello? All right. Zubair, I think go ahead, please.
Yeah. So I mean, this famous curve. The whole thing is this is an. So the first rule of epidemic is you should do as much testing as possible and then start quarantining people early on. What happened with us in US? We almost wasted first 3 weeks, which is a way long time for this virus to spread. It was so hard to get any testing done in first 2 to 3 weeks. I cannot even imagine. I can't even tell you. I spent hours talking to CDC to get one test done. So what happened within those 3 weeks? This virus keeps spreading, and that's why the curve will be higher now, because we didn't stay ahead of the curve. We are now chasing the curve, and the person in driving seat is actually the virus itself. And as far as the question is how long will it take, I would say it's not humans who gonna decide it. It's the virus who will decide the timeline of this epidemic.
I see. I see. So, what is your take, Irfan?
Well, I mean, right now the numbers are going up because we've started testing more people. Every single day, more people are. So the number of people is going to increase. It's not because the disease is spreading. I mean, disease is obviously, more cases are becoming positive now. And like Zubair was saying, so once we know how many of them are there, only then we can get an idea of uh, uh, that how long it would take or what the severity of illness is. But it would be it's not going to be in weeks. Uh, it is a good possibility that it would go on till so.
All right. So, like Ahmed was asking, is it going to be something like a similar scenario like when the HIV came in? It was epidemic, and people were having sporadic cases, but it wasn't like this. And finally, they were able to. They ordered some time, and they were able to develop high potency drugs and vaccines and stuff like that to improve the longevity. Not vaccine for HIV, but for other kind of diseases which were killing them, like pneumocystis this and talks about plasmosis and stuff like that. So they got better treatments. So is that something which will have to live with, or Zubair?
No, I don't think so, because HIV virus was very different than this coronavirus. So let me just give you a little bit of the history. This virus is called SARS coronavirus 2. We had an epidemic of SARS coronavirus 1 in 2002. So if we look at that epidemic, how did it start and how did it end? It never became pandemic at that time, but it started in September 2002, SARS coronavirus 1 epidemic, and it ended in July 2003. It actually spread to almost 32 to 40 countries in the world. There was almost 8 to 10,000 infected people. So there is some hope there that because that epidemic ended once summer kicked in, theoretically, I think I mean, scientists don't believe that, but there is some hope because that epidemic ended pretty fast in July. So we are hoping that once summer kick in, hopefully, if not completely, at least it will ease down a little bit. But that's all hope, and that's our wishful thinking as well. Only time will tell.
All right. Ahmed, any other question?
Maybe I'll just pause if anyone else on the line has a question. If not, I have another one, but anyone else on the line, does anyone have a question? Please unmute your phone and go ahead and ask.
Brother Ahmed. I have a question just on that last comment. First, I would like to thank the panel. I think this has been very informative for us, so thank you. My question was related to heat. So would washing hands with hotter water or warmer water, will that help too? Thank you.
Yeah. So I don't think so. It's not the water, it's the combination of soap and water that actually kill this virus from your hands. So it doesn't matter if water is hot or cold, it doesn't really affect this virus.
What Zubair is really saying is that the properties of the structure of the virus has a lipophilic coat, the lining, and so that actually dissolved. It gets broken by the soap and the ingredients in the soap, and it causes these holes. If you have seen those, a lot of videos on that, that is the need for it to disintegrate.
Okay, thank you.
Well, Sister Christy has a question. Please go ahead.
Assalamu alaikum, jazakallah khair. Thank you so much. So I have been reading reports that people that are in Wuhan have that had the virus and they recovered from the virus, that they are being retested and they're asymptomatic, but they're still carrying the virus. So have you have any information on that, about if there are carriers of the virus that don't show any symptoms, and once you have the virus, are you a consistent carrier of that virus?
Yes, so that's the missing part of the puzzle. Right now, we have a lot of data about the disease, about the death rate. The missing part of the whole puzzle is how many asymptomatic carriers are out there will keep spreading this disease. And no one has the answer there. I saw that study coming out of Wuhan, like, yes, they are having re-emergence of that virus in their population. So, yeah, this is the unknown territory. No one has the answer there. I would leave it just there.
I see. So is it? I think little more.
Dr. Shakur, I think your audio is
At some point
very
we will think
broken up.
about herd immunity and things like that. If the infection hasn't developed any, and he has been reinfected, that's not very comforting thought. But at the same time, I think, correct me if I'm wrong, the okay. All right.
It's okay now.
Okay. The same. So, I think it is the symptoms are based on the immunological response. Is that correct, Zubair?
That's correct. Yes. Your symptoms mostly depend how your body reacts to this virus. So there is we call these cytokines in our bodies. When virus attacks you, these cytokines are released in your body, and then you have these white cells that also act in combination with all these cytokines, and your body develops symptoms according to that. That's why when people get really sick, it's called uh, dis actually disorganized response of your body to these infections.
I see. I see. So let's the any the way we treat any epidemic or pandemic is vaccine, for example, vaccine or pills. So what should we be expecting in the future? I know we have heard about hydroxychloroquine, and you and I and Irfan are very used a lot in our practice in Pakistan. Is there any hope, or should we be doing it, or are you using it?
So as for, I mean, hydroxychloroquine, yes, I mean, it's an anti-malarial drug. Out there for decades. We don't even use it for malaria anymore.
Yeah.
Malaria is immune to hydroxychloroquine now. So this is the new hydroxychloroquine has antiviral properties, and now we know it. There is a lot of in vitro, like in vitro mean animal studies data where uh, hydroxychloroquine was very effective against this virus. There is a recent study that came out of France, but it had very less number of patients, small study, but it did show benefit of hydroxychloroquine in comparison to placebo. But I think we need better trials. There is no drug so far that has been approved to treat this particular disease. So this is all on trial basis. There are at least 10 phase 3 trials are going on around the world for hydroxychloroquine, and there is 5 more going on for another antiviral drug. It's called remdesivir. So people are putting a lot of hopes in these two medications, but I think we should wait for the data. I know a lot of people around the world can get hydroxychloroquine over the counter. I would say please do not take it without your doctor's approval. These medications have a lot of side effects. There are two people, two husband and wife actually in Tucson, who took hydroxychloroquine. Husband died right away. Wife is in ICU because these medications can give you cardiac arrhythmias pretty fast. You can potentially die of taking it. So please do not take it without your doctor's guidance.
Good, thank you. Any other question? Anybody has any question?
Yes, Dr. Shakur, I have a question. So one of the things you mentioned earlier, or somebody mentioned earlier, I think it was maybe Dr. Irfan, about the immunosuppressants and that could affect, or you're more at risk if you're on some of those medications. So personally, I have asthma, and one of the medications I take is Dupixent, which my understanding is it is an immunosuppressant. So then is the recommendation at this point that one should not take these medications, or is there anything else to take to boost the immune system, or what is the recommendation?
So I think what Zubair was saying was, Irfan was saying was that people who have were on heavy dose immunosuppressants like methotrexate and for
Okay.
treatment of some of the rheumatologic diseases, they are on those medications. And yeah, steroids are considered immunosuppressant, but if you really need it, you should take it. But just from the fear, I will let actually Irfan comment on that. Irfan?
Gee.
So, go ahead, please.
Yeah, I think you should continue to take your medications. You should not stop the steroids if that is something you need for your asthma. That may stopping that may be more detrimental to your health than anything else. Now, the main emphasis rests on prevention. I mean, all the measures that we can do to actually not get exposed to the virus is where the effort should lie. And that would give you the biggest bang for the buck rather than stopping prednisone.
All right. Emma, does it answer your question?
How much reality to this rumor that the virus is airborne?
I'm sorry, can you repeat?
There are reports circulating around that the virus is not droplet but airborne. How much reality in that?
So, as the virus being airborne, the virus can act. What we are looking at are the people who are getting those breathing treatments, and in the hospitals, the virus can actually stay airborne for 3 hours after after a. So yeah, I mean, so we are extra careful on those patients in the hospital who actually are getting treatments that can make the virus become more airborne, like the nebulizer treatments and procedures like intubation and bronchoscopies. And so about 3 hours is the time.
Doctors, we have a question in the chat box. Brother is asking how to carefully consume produce from the stores, even if they are packaged. So I guess if we go shopping.
Hello?
Zubair, could you take it?
I mean, what I would say, like all these
I think-
products, the grocery shopping thing. What is that?
Go ahead.
Yeah. So I think in this kind of epidemic, we should decontaminate our houses on a daily basis, like countertops, uh, your phones, your doorknobs. And by disinfecting, I mean you can use this Clorox thing, or you can have dilute bleach solutions, and you can actually make it at home. You can add 5 tablespoons of bleach in a gallon of water and then clean all these surfaces. Getting food or these vegetables or all these fruits from the market, please wash them with running water for a few minutes before consuming them. And if these things have coverings on it, please try to peel off the coverings before you eat them. And then keep washing your hands very frequently. I think that's probably the maximum we can do.
So it's a wise thing to, because people won't call you OCD if you're doing it on door handles and countertops.
Yeah, I mean, it's just like preventive measures. I mean, as I said, this infection, it's not about the treatment, it's all about prevention now. So whatever we can do comfortably, I mean, I know it's OCD, but if we are overreacting, I think we are doing the right thing.
All right. Okay. Any other question?
And another question from the chat box about vitamin C. Is vitamin C effective?
No one knows.
I don't think there is any evidence. Vitamin C is an antioxidant. I don't think there is any data out there that vitamin C is effective in preventing or treatment of infections.
I see. So in nutshell, prevention, 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 and wash your hands, stay away from each other, personal, physical distancing, not social distancing. Socially, you should continue somehow, but physical distancing. And when you are with, when you come home, make sure you have washed your hand before you go to your elders, or especially grandma and people who are immunocompromised, who have a kidney transplant or are undergoing chemotherapy and things like such. And you can still wish them well from the distance, from a 6 feet distance. That's safe. And if you have any sort of cough, put on a mask. And one of the things which I was reading was that one of the doctors from China who had mentioned that we have failed in using masks in Japan. One of the reasons that culture has built-in way of using masks all the time, and in Japan, the spread of coronavirus has been very little or negligible. So things like that, I think we have not given a whole lot of importance in mask in our culture, but I think it's something to get started. And whenever we have seen people from Malaysia, in like for we go for Hajj and brothers, people from China and from Malaysia, they always have worn masks. You know, even when you're doing tawaf and you see them all the time, but none of the other nationalities I saw wearing masks. So I think that's a big difference. So that is something to bring in life, especially for these days. And then, if you suspect you have a problem, go get it tested. But with the clear understanding that you are exposing yourself to more problems. So make sure you plan it properly. Wear a mask, call the doctor, don't use public transport, and get yourself answered. Any other questions? So Ahmed, would like to ask you that any you're in contact with massages. What is going to happen with the massages?
So as of right now, the recommendation continues to keep the masajid closed, whether that is for Jummah prayer or for the 5 daily prayer. And I mean, we would be waiting for you, meaning the doctor's recommendation on that for now. But as of right now, there is no. It's still kind of as you go, and there's no guidance to reopen anything at this point. And from what I'm hearing, it looks like this is not going to be another week or two. It seems like it's going to be some time, Allahu Alam. But we will wait for recommendations from of course, the doctors, from CDC and the health departments in general before the recommendation would change.
It will also affect the Tarawih.
Yeah, if it continues until Ramadan, that will have to be the case. So I think most organizations were asking them we're asking all the masajid to remain in contact with their congregation through online forums like this. I know ICC has set up a few webinars. ICEV continues to do so. Even their Quran school has gone to an online program. So we're asking the community to stay connected using the technology available. Alhamdulillah, there's plenty of technology available to keep us in touch with each other. As far as going back to the masajid, we'll have to wait until you guys clear the situation. But for now, that is what it is. We ask Allah subhanahu wa ta'ala to protect us, our families, our communities, and mankind in general, and to get the pandemic over with, and so life can return back to some of its normal paces, inshallah.
Thank you. If there are no other questions, we will close the meeting. Is that okay?
So, Dr. Shakur, Dr. Qurashi, Dr. Khalid, thank you guys so very much for joining today. I think this was very informative. I really appreciate it. We did record the session, and with your approval, inshallah, we would like to share that widely so the community can benefit, inshallah. And for the rest of the community, thank you for joining today and asking your questions. We would like to remind you, inshallah, we have 2 more webinars coming up. One about homeschooling and how to make the best of that, inshallah, and another one about staying healthy in Ramadan. Those are coming up. You will see the flyers, inshallah. So please look for those and join when the flyers hit, inshallah. Jazakumullah khair, everyone, for joining. And again, doctors, thank you so much for your time. I appreciate it very much.
Thank you for the opportunity.
Thank you. Assalamu alaikum.
Thank you very much.